We all know someone who has developed cancer and has either survived or lost their battle. Today, we'll be talking about and informing you on breast cancer awareness.
In this segment, we'll inform you on this type of cancer, the importance of self-examination, doctor recommendations, and support groups, as well as donations.
Breast cancer is when breast cells divide uncontrollably and develop a tumor. These cells can then invade other tissues and spread. Breast cancer is most common in women but can also happen in men.
Yes, that's very true and possible. In fact, in the U.S. alone this year, 2,600 new cases is estimated to be diagnosed in men. In women, 246,660 new cases are estimated, and 440 men and 40,450 women will die.
These statistics are so scary to think about, and the reason these numbers are so high is because most breast cancer is diagnosed in a late stage.
Breast cancer is staged in 5 stages: Stage 0, Stage 1, Stage 2, Stage 3, and Stage 4. Staging cancer is to be able to give you a clue of how your cancer has stayed at its original place or if it's spread. Stage 0 is non-invasive, meaning there's no evidence to the cancer having spread from where it started. Stage 1 has 2 subcategories. Stage 1A is when the cancer is invasive and the tumor is 2 centimeters or smaller, but the cancer has not spread outside of the breast. Stage 1B is also invasive, but there's not a tumor. Instead, there are small groups of the cancer cells between 0.2 millimeters and 2 millimeters in the lymph nodes. There can be a tumor from stage 1A, but those small clusters must be in the same lymph nodes to be 1B.
There's also Stage 2, which has 2 subcategories, A and B. Stage 2A can have no tumor in the breast, but a tumor larger than 2 millimeters is found in the 1 to 3 axillary lymph nodes. There could also be a tumor up to 2 centimeters that has metastasized to the axillary lymph nodes. Or it could lastly be a tumor larger than 2 centimeters, but smaller than 5 centimeters and hasn't spread to the axillary lymph nodes yet. Stage 2B can be a tumor larger than 2 centimeters, smaller than 5 centimeters, and or small groups of cancer cells between 0.2 millimeters and 2 millimeters found in the lymph nodes. There can also be a tumor between 2 centimeters and 5 centimeters that has metastasized to the 1 to 3 axillary lymph nodes or the lymph nodes near the breastbone. There could also be a tumor larger than 5 centimeters that has not spread to the axillary lymph nodes. Stage 3 is divided into A, B, and C categories. Stage 3A can be when cancer is found in 4 to 9 axillary lymph nodes or in the lymph nodes near the breastbone. Also, when the tumor is larger than 5 centimeters and small groups of breast cancer cells are found in the lymph nodes. Or when the tumor is larger than 5 centimeters and the cancer has spread to 1 to 3 of the axillary lymph nodes, the lymph nodes near the breastbone as well. Stage 3B is represented when there is a tumor that has spread to the chest wall or the skin of the breast, causing swelling or an ulcer that may have spread to up to 9 axillary lymph nodes or lymph nodes near the breastbone. Stage 3C is when there's no sign of cancer in the breast or if there's a tumor any size, and the cancer has spread to 10 or more axillary lymph nodes or the lymph nodes near the breastbone, lymph nodes above or below the collarbone.
And lastly, stage 4 is when the breast cancer has spread beyond the lymph nodes and breast to other organs of the body, like lungs, skin, bones, liver, or brain. And now that we've explained a little more than the common knowledge about breast cancer, here's the doctor with her recommendations. Hello, doctor. Can you let us know a little more about breast cancer that we should be aware of?
Yes, absolutely. Now that these ladies have given you the basics, I'd like to start with prevention, signs, and symptoms. There's no one way to prevent breast cancer, but there are some things that can be done to lower your risk. For example, keeping a healthy weight, becoming more active, and eating healthy. If you are at a higher risk, there's medication to try and reduce the risk. And if there's a history of breast cancer in your family, you can be tested to see if you have a mutation that increases the chance of breast cancer. Surgery could then be considered to lower the risk. As for signs and symptoms to look for, the most obvious being a new lump or mass found on the breast that you've never felt or had before. Also, swelling of the whole or parts of the breast. Skin irritation, dimpling of the breast, pain, nipple turned inward, nipple discharge that's not breast milk, and lastly, redness, scaliness, or thickening of breast skin. So the most important thing to always remember and do is self-examinations. Being able to feel and look for differences in your own body is crucial. Here's how easy and quick self-examinations can be. You can self-examine in 5 quick and easy steps. Step 1. In front of a mirror with shoulders, back, and hands on hips. Look for unusual size, color, and shape, making sure they're evenly shaped. Step 2. Raise arms and look for the same changes as before, size, color, and shape. Step 3. Look for any liquid coming out of one or both nipples during examination. Step 4. Next, lay down with right hand, examine your left breast while left arm is up. Use your fingertips to examine in circular motions the size of quarters. Do the same on the other breast with the opposing hand. Examine breast thoroughly. Step 5. Lastly, examine both breasts the same way as before, but while standing up.
Thank you so much, Doctor, for your time and knowledge. And to end our segment, we'd love to inform you a little about support groups available for women diagnosed with breast cancer and breast cancer survivors.
We also have some information on how you can donate. There are many support groups available. The best place to find a support group in your area is to go to www.cancer.org/treatment.
The best way for you all to help is to donate at www.nationalbreastcancer.org. Your donation will help provide mammograms, breast health services, and support for those in need.